In today's video, we're exploring one of the most talked about alternatives to Botox and invasive facial procedures, facial acupuncture. If you've been curious about this practice that's gaining serious popularity, you are in for a treat.
With a cosmetic facial acupuncture, it's really treating the whole body and everything going on below the face. So you can't separate what's showing up on the face from everything that's going on below, whether it's inflammation, gut issues, stress. And so during a session, we're really treating all of that and digging up all the trauma and all the emotional stress, all the emotions trapped in your face and muscles. So as opposed to, just going for a regular traditional facial that will treat your face locally, the results may be more temporary because you're not treating the root cause of why those lines are showing up, why the puffiness is there, why your face is starting to sag or droop. You really want to address the underlying reason behind it all.
You're going to learn how facial acupuncture naturally encourages collagen production, helps with fine lines and wrinkles, and discover why it's so much more than just a face treatment. I brought my sister Kari along to experience her first facial acupuncture treatment with Dr. Erin Lee from Madison Acupuncture. Erin is a licensed acupuncturist who takes a whole body approach to facial treatments, understanding that actually what's happening inside of our bodies, especially our hormonal changes, directly impacts what we see in the mirror. She not only specializes in facial acupuncture, but also for many different health conditions, whether that's pain or gut issues, hormones, and so much more. I'm Risa Morimoto, your host, and you're watching Modern Aging, where we chat about healthy ways to navigate midlife holistically. If you're new to the channel, I'd love for you to subscribe. All you got to do is click on that button below, and then that way you're going to get notified every time we post a new video. Now let's dive in.
So what were you concerned about your face? What did you want to concentrate on?
The whole aging process, you get the 11 lines and this coming down here, maybe over here, the dryness, the crepiness, and over here, neck, the lines. And
so just looking at your face, have you had any kind of grief in your life?
Plenty. Yes, I have. Yes.
Recently, or has it been like a few years? Or
it's been a few years, but it was a lot. It was very heavy. I lost my parents. I had gotten a divorce. Lost my pets. Lost my home. It was a lot.
Yeah.
And why is it showing?
So yes, in Chinese medicine, like all the lines that show up on your face are a result of repetitive emotions, things that get kind of stuck in your body, your face. What shows up on the face, it's a result of what's going on in your body. So right now with you, I see a lot of kind of kidney imbalance, that grief on your face, those lines that are formed. So with the facial acupuncture, we'll kind of try to address all of that internally too, not just what's showing up on your face. So
as far as kidney, where's kidney?
I see kind of the puffiness,
really?
Swelling under the eyes. This under eye area is the kidney area.
Okay.
So I saw from what you filled out, you're having dryness, night sweats.
Not so much anymore, but
Not anymore?
Yeah.
So as you get older, you've hit menopause, you said?
Yes.
So typically as you get older, your yin depletes, and that causes that dryness.
Yin
the kidney,
is more
yin
female?
Yes.
Is yin female?
Yes.
Okay.
So that kind of correlates with fluid deficiency, manifesting as dryness, things like that on the face. So that deficiency can show here too. Fatigue, how do you feel energy-wise?
I have that midday slump, usually.
I mean, as you get older, that kind of tends to decline as well, right?
Right.
This
The
under
stamina,
area, it's like adrenal fatigue or related with kidneys. So as our kidneys get worn out, you may notice more puffiness there too.
Okay.
So right now, that's what I see and what we'll try to resolve with the facial acupuncture. So I also do body acupuncture, and what we're going to be doing is boosting the kidney function and helping the grief gets stuck in the lungs. So we're going to work on boosting your lung function and just treating internally everything that's going on, that's showing up in your face.
Okay.
Can I see your tongue? So I do see a lot of kind of deficiency, like yin deficiency, or the cracks showing in your tongue. So what I notice, it's a little bit puffy, and that also correlates with the swelling. There's a bit of cracks here. That's the lung and spleen, stomach, digestive area. So that the cracks just indicate to me that fluid deficiency, or that yin deficiency as well. You know, when there's a deficiency in the spleen, stomach, the digestive area, you're going to have a hard time transforming food and fluids, and that's going to show up on your face as well as swelling or puffiness. So
I've been experiencing bloating, so that's all correlated.
Okay, yeah.
Right?
So that's also an indication that your gut is having a little bit of a problem transforming and moving food.
So what can I do at home, improve my, I guess, my fluid intake, my nutrition? Like, do I have
to help with
my
that
diet?
To help with that spleen, stomach deficiency, right, that I see, you do want to drink room temperature water or warm. Make sure you avoid cold water.
Ever since menopause, I just feel like I have to get cool. Like I just sweat profusely, and I'm like, I don't know what's happened. It's like this furnace, right?
Yeah.
So
as you get older with the yin deficiency, that is exactly what it is. Your body is creating that yin deficiency heat. So that's why, you know, you're drying out your fluids and things like that. So you do feel more heat, especially at night. In general, you know, your stomach needs to be warm. It's like a furnace, right? It needs to be warm to digest food, break down food. So, you know, if you're putting cold water into it, it constricts your blood vessels, impairs your ability to digest food. Your stomach needs to create more heat to warm that cold water down. If you keep doing that over long term, it's going to lead to that deficiency in the stomach that I see. But in general, with food too, you just kind of want to stay away from heavy, sticky foods too. Do you eat like avocado, bananas, tropical fruits,
I love
dairy?
all that. Dairy.
You eat all of that?
I do.
Is that the majority of your diet?
My gosh.
Are you eating salads, raw vegetables?
Salads I love. But I also love sauteed, cooked vegetables.
So in general, you know, for someone who's healthy and has a strong constitution and they don't have any issues with digestion, then they should be able to eat all this, and, you know, their body should be able to handle it. But when it's impaired, all of that just makes your body need to fight harder to digest it and break it down. So things like avocado, banana, tropical fruits, dairy, the sticky, heavy foods, if you're putting that into your stomach, you know, your body just needs to it's like a wet towel weighing down your digestive system, and your body needs to choke through to break it down. So in general, for you, if you could drink more, for vegetables, try to avoid raw vegetables and salads, and cook it, saute it, dark green veggies. If you're going to be eating a salad, then try to have some warm ginger tea after to help your body break it down.
Okay.
For as far as fruits, try to go more towards berries, apples, pears, things like that. Pears are also great for your lungs.
Okay.
The grief that I see.
Okay.
So maybe try to switch dairy as well. It's kind of heavy and sticky, right? So try to avoid cheese and things like that. If you're gonna have cheese, maybe go for more like harder, low moisture cheese, like Parmesan or something like that.
I don't eat cheese, on a daily basis, but I do drink my tea or coffee with a little bit of milk.
Okay. I mean, you try to limit where you can. Even with the milk, maybe you can switch to a different kind of non-dairy. But in general, when all of your diet is like that, that's what leads to what I'm seeing right now with that difficulty and the deficiency in the spleen, stomach. And that's all going to lead to that swelling in the face.
Okay.
So.
Do you recommend any herbs to help?
So generally, I
spleen or
don't
support
recommend single herbs for anyone. I do prescribed herbal medicine, like herbal formulas. So these are herbal formulas that will be used for thousands of years, and it helps to kind of boost your organ function and these deficiencies that I'm seeing in you. So generally, we'll start with acupuncture, and then a lot of these imbalances will go away after just a few sessions.
How many sessions do you think it will take?
For
Or
the
to be
facial
effective?
acupuncture, you have to think of it kind of like taking your face to the gym, right?
Yes.
If you're gonna work out, like you'll feel great after one workout, but to build that muscle strength and really make long-term changes, you do have to commit. So for a facial acupuncture session, it's a series of sessions, about 12 to 15 sessions weekly, and then for the full program, what I recommend is microneedling once a month, and then the facial acupuncture in between. So they work in different ways. With the microneedling, it's kind of more all over facial collagen building. It's better to get into all these like fine lines that I see, maybe in the forehead. The needle is better for these darker, like the grief lines that I see.
Now, are
For
you
the deeper.
injecting something into the skin?
For microneedling, no.
Yeah, it's
No.
just needles.
Mhm.
So you're just kind of stimulating.
Yes.
Collagen
So it's just like getting
production.
needles all over your
Okay.
face. And that microtrauma is what's creating collagen and stimulating the collagen production.
Okay. Is it very painful?
For
I mean,
microneedling or
it's
for-
very for microneedling. I mean, it's sensitive around your eyes here.
So I go at probably more of a shallow depth than you're going to go get anywhere else. And a lot of the more recent studies show that a more shallow depth is more beneficial
Okay.
for the microneedling because you're not destroying the layers of the skin underneath. And the fibroblasts are still stimulated by working more on the surface. For me, I don't like to use a numbing cream because when you do microneedling, you're increasing the absorption of products by more than 2,000%.
Oh, wow.
So you have to be really careful with what you put on your face. And for me, I don't want the chemicals of a numbing cream to be absorbed into your skin.
Okay.
So, I go start at a shallow depth, and we can always adjust that according to your comfort level. Let's get started then.
Okay. Thanks.
So right now, this is one of the most powerful points for whole body circulation. It's also great for your digestion. This also is digestion. A lot of it, what we're doing is for digestion. So for everything starts in the gut, your circulation, inflammation, stress. If your gut is in distress, your mind, it's going to create more anxiety. So right now, this is the major point for circulating your liver qi, helping with some of that bloating that's caused by poor circulation. So this, like I said, it's the point for that dampness in your body. So dampness in the body, it's a Chinese medicine term for what we were talking about before in terms of, if your spleen, stomach is not digesting food properly, then there's going to be, you're not going to be moving fluids. It's like, imagine like a heavy wet towel weighing down your digestive system. That's what the dampness is doing. So you want to help your body to get rid of that dampness with things like that ginger tea, avoiding the foods that contribute to that dampness, those heavy, sticky foods. So with all of these digestive points, we're trying to boost the function of your organs to help your body move things to get rid of that swelling. Basically, what we're doing with all these body acupuncture points is getting things moving. That's the point of any kind of acupuncture treatment. So we're going to get started with your face now. We're going to do a lot of needles along the jaw here. It helps to define that jawline and lift muscle. So we're going to be working on some of those deep lines that you had. You can't see them as well while you're lying on the table here, but with the needle you can target them and kind of it's threading the lines to decrease the appearance of them and stimulate the collagen production underneath to fill them out. So with facial acupuncture, you can get very targeted, just target specific lines like this. Microneedling you can as well, but this is good for the deep lines because you can go in deep to target them. Also, what I'm targeting is specific muscles, your masseter muscle. Usually if you have a lot of stress, these are going to be very tight too. A lot of people grind in their teeth, right? The side effects of the facial acupuncture is that you're going to end up feeling looser. It helps with jaw pain. So what the needles are doing are, I'm going for specific muscles basically to lift that muscle, and it's almost like working out that muscle for you. As you mentioned, you know, as you get older, things start to sag, muscles lose their tone, and the needle is kind of working their muscles out to strengthen and tone. So as you can see, we've threaded all of the lines here. They're her 11s. And what we're doing now, we're working on lifting. As you get older, your eyelids you tend to droop here, right? And you get the hooded eyes. So with the acupuncture, you can work on lifting that back up. The acupuncture, actually, it's great for, and the microneedling is actually great for hair growth too. You mentioned dryness. As you get older, you get dryness, right? The same, your scalp also loses its nourishment, the blood circulation to the scalp, and that's what causes hair loss. So all these needles bring that blood back up. The needle creates a microtrauma here, and that's what stimulates your body to heal the wound. And that's what stimulates collagen production, brings oxygen and blood to the face, gets things moving.
Can you tell?
No, I can tell.
You can?
Yes.
Do you feel more lifted and slimmer? So we should ask her, how do you feel?
This is amazing. Just one session. Oh, thank you so much.
Oh, you're welcome.